Cadillac Unscripted on 107.9 CDY is sponsored by Independent Bank as well as Marianne Quist of Remax Central, and it's time for another half hour of local chat. Katy Huckle is here with me. Good morning, Katy.
Good morning and happy Halloween.
Thank you. And you are, I wish we had a webcam here in the studio because you are dressed the part today.
Yes, I am a scary spider. A scary spider today in the studio.
Is there anything else besides a scary spider?
No, they're
exactly.
the worst. Well, snakes.
We have, agreed there, a public information officer from District Health Department number 10, Jeannine Taylor, with us. Jeannine was with us at the very beginning.
She was.
Of the COVID-19 outbreak way back in March, and we decided to have her back because A, there's a lot of new information to disseminate.
That's
but
right.
B, there's a lot of people on the fence. Moms and dads are wondering, should I take my kid Halloween trick-or-treating?
Yes.
Should I not? Should I avoid it? It's a big decision to make.
It sure is. And as parents, we want to do what's best for our kids. And I always say knowledge is power. And Jeannine, that's why we need to talk to you about this. What is the health department's take on Halloween in 2020?
Well, Halloween is like other holidays. You know, 2020 has proven to be just a horrible year for holidays, and
Yep.
Halloween is one of them. It's a day that most kids look forward to, no matter what age they are, to get dressed up and get out and celebrate and have some fun and go get some candy. This year is going to be a little bit different. However, it doesn't mean that we're saying shut it down and don't go trick or treating. I think again, it's up to each parent to make that decision on what they want to do. There are ways that parents can safely take their kids trick or treating, and that people in the public that are planning on handing out candy, there's some tips and tricks that they can do as well for Halloween. So we actually have a document. I sent it to you guys so that you can share it on your website or Facebook page. Just some things that we can all do to stay safe this Halloween, and it has some helpful tips.
Oh, thank you. Let's share some of those if you don't mind.
You know, but before you go any further, Jeannine, I think this is a year when a lot of parents who are kid-centric, a lot of people who are kid-centric are saying we've got to give the kids something fun to do. It's been miserable for them the last 7 months.
I couldn't agree with you more.
So set out that candy. Let's do it.
I think you're exactly right. I think people are like, so much has been taken from kids, their sports, their dance, their social life, their school, that, can't we give them something? Good point, Rich.
Yeah. Okay, Jeannine, sorry, I didn't mean to interrupt, but I wanted to kind of throw that in there.
Yes.
So what's the District Health Department number 10 stance on this?
Well, again, I agree. I think it's been a tough year. A lot of no's, a lot of sorry, can't do that right now. A lot of shutdown, and people are over it. They are just ready to get back to normal. I just think that it's important for people to take baby steps
Okay.
Before just completely throwing off the mask and resuming life the way it was. It's important, as we are noticing that cases are going back up. In all of our 10 counties. Well, Wexford County hasn't gone up as much as some of the others, but we'll get to that later. Let's talk about Halloween. So Halloween, again, if you're a homeowner and you're planning on handing out candy this year, there's some tips that you can do to just do it safely. First and foremost, don't hand out candy if you're sick. If you are ill, have a cold, have a cough, have a fever, have a sore throat, have a runny nose, don't hand out candy. Just do everybody a favor and forego that. Keep your light off, and the kids will move on to the next house.
Okay.
If you are planning on handing out candy, again, the tips are very similar to what we are still asking people to do. Number one, wear a mask that covers both your mouth and your nose. Make sure that mask is worn appropriately. If it's just covering your mouth and not your nose, you can still release droplets out your nose that may be infected with COVID that can get on other people.
Okay, I didn't know that.
Again, masks are to protect me from you and you from me. If I have COVID and I don't know it, the mask is going to protect you from me.
I see.
And from my droplets getting on you. So if I'm wearing a mask and it's not covering my nose and I sneeze or I snort or I, breathe out heavily through my nose, my droplets can then release. The mask isn't blocking the droplet coming out my nose, and it can get onto somebody else who may be wearing a mask, but the droplets can still, get in through their eyes, and if the mask isn't very tight, it can get in through their mask. And so masks are to protect others from us if we are sick. Mm-hmm. So wear that mask appropriately. Think about using duct tape to just mark the 6-foot lines in front of your home, and hopefully, encourage people to follow that. Step on the 6-foot mark. Wait your turn until the next person that's getting their candy is gone before you move up. Position a distribution table between you and the trick-or-treaters so that keeps that buffer, if you will, away from the trick-or-treaters coming right up and right close to you. Distribute candy on disinfected tables to eliminate direct contact. So again, if you're setting candy there and kids are going to pick it up, just make sure the table's disinfected and that you're cleaning it often. Wash your hands often. Consider handing out candy in an open space where distancing is possible instead of right at your front door. Consider a neighborhood costume parade. It's an easy way to keep safe space between children. So those are all some tips for homeowners that might be handing out candy or want to have, partake in the festivities. Now, for parents and trick-or-treaters, again, it's important that parents explain to their kids that this is a unique year, that things are a little different this year than they have been in the past, and just explain to them why that is, so that they have an understanding that this year may be a little different than last year or the years past.
So set expectation.
Exactly.
Okay.
Just kind of let them know it's a unique year. It's just, we have to take special precautions this year that we didn't have to take last year. And there's a reason for it. It's for our health and the health and safety of us and others that are around us. Stay home if you're sick. Unfortunately, kids, if they're sick, or parents that plan on taking their kids out are sick, make sure that you stay home. Talk to kids about safety and social distancing guidelines, what's expected before they get out there, so that they understand when you're saying, hold on, wait a minute, stay 6 feet back, step on that mark. Right. They know up front that they can expect that.
And I think that the schools have done a good job too. So they're seeing this, in school. So it should be somewhat normal now. I guess this is our new normal. Mm-hmm. What about actually the consumption of candy? Is that, let's not be eating while we're trick-or-treating, let's save it all and get it all home? And what should that look like?
Yeah, I think that's a smart tip because, again, how do we get the virus? By putting things in our mouth with unwashed hands. And so if the kids are about and they're touching things and, their hands haven't been sanitized, absolutely. I think let's hold off on eating that candy until we get it home. We've gone through it. We we go through to make sure it's all safe, that the kids have, sanitize their hands, clean them well before they start opening up that candy and putting it in their mouth.
Okay.
Yep, that's a good tip.
Thank you. Okay, and how young is too young to trick or treat? I suppose it's a matter of opinion, but from your professional perspective, how young's too young? I
don't really have it's just not, that's not for me to say. It's really up to the parent what they believe as far as the age range goes. Again, just taking all of the circumstances into consideration when you go out with your young ones. And if you are unable to keep them distanced, unable to keep them masked, unable to keep them separated from others, then you may want to think of doing something different other than trick-or-treating. So there's a lot of resources out there. And again, this guidance that I'm going through is available on our website, and I sent it to you guys so you can put it on your website too.
Wonderful. Good. Well, I think people will be encouraged to know you're not saying no, you're saying be careful.
Absolutely. It's just like everything else. If anytime we go out in public, whether it's us or the kids, we always have to be aware of our surroundings and be aware that the potential is always there for somebody to have COVID and not know it. And if they're not following the guidance, they're not masking, they're not social distancing, they're putting other people at risk. And so let's do it for each other and follow those safety precautions and mitigation strategies so that everybody can have a safe Halloween.
It's a little bit different this year, Jeannine, and this is putting COVID aside for a second with Halloween being on a Saturday this year. That means it's not quite as damaging if the kids decide to, ingest a whole bunch of nerds and they get the sugar rush and they can't, they have trouble going to sleep because it's not a school day the next day.
Bouncing off the walls.
And
Right.
and we get an extra hour of sleep on Saturday night because we're turning back the clocks tonight.
Fall back.
Yeah. So
This is a super Halloween. It's a super Halloween this year.
And not only that, but the weather forecast is actually quite good.
Okay, no rain.
Sunshine and about 50 today, and we're looking at about 35 to 40 degrees maybe at trick-or-treat time, but no precipitation as far as we can tell.
Wow, yay.
So, Ben, we've had miserable Halloweens of late. We really have.
Cold, rain, sleet.
So it is nice to know that there can be some sense of normalcy for Halloween this year for the kids. I think that's comforting.
Right.
Yeah.
Absolutely.
Well,
and it's only as good as everybody makes it. You know what I mean? If we all just do our part to be safe, it can be a fun event for everybody.
Jeannine, we're going to take a break and we're going to spend the last 15 or so minutes talking about, getting an update from you on what's been going on in the region since we haven't had you on in 7 months and so much has happened.
So much has
Absolutely.
happened.
So we will take a break and be back in just a couple of minutes here. Cadillac Unscripted is sponsored by Independent Bank and Marianne Quist of RE/MAX Central on 107.9 CDY. Buying a home is still the great American dream. And yes, it can be an intimidating process. But you can rest assured and have confidence when the professionals from RE/MAX Central are in your corner to guide you through it. Marianne Quist of RE/MAX Central has helped hundreds of home buyers in and around the Cadillac area navigate the process over the years, and she's ready to help you too. From start to finish, from finding a home to submitting an offer, to understanding the purchase agreement, to inspections, surveys, and appraisals, to the time when you finally sit down and sign those closing documents, Marianne will be there. When you're ready to buy, talk to Marianne Quist at RE/MAX Central. See her listings at teamquist.com. Cadillac Unscripted on 107.9 CDY. We are back with Jeannine Taylor from District Health Department number 10. And so much to talk about. We got an update on Halloween plans here just a few minutes ago. And now we're going to go and talk a little bit about some facts and figures regarding COVID-19. So, Katie?
The numbers don't lie, do they, Jeannine? Can you tell us where we're at in Wexford and Missaukee counties?
Absolutely. So as of today, I'm working on opening up my dashboard and the website. For those of you who aren't aware, District Health Department number 10 has a data dashboard on our website. And that's a place you can go to dig into the data a little bit deeper to kind of get age range and zip code and, deaths by age range or probables or recovered numbers, just some more data for the county in particular, for the counties that you live in or are curious about. We have some of that data on our dashboard, and it's just some good information. Another thing that we started doing is county profiles. A lot of people want to know, okay, here's the numbers, but what did we see? Like, what was causing these increases? And so the county profiles dig into the previous month. So right now, September's profile is up there, and soon we'll have October's. Usually the first week of the next month, we do a look back at the month previous and do a summary about it. And just kind of tells you where we saw some outbreaks and things like that. But in Wexford County, we currently sit at 161 confirmed cases total.
Okay.
And Missaukee County, we are at 74 confirmed cases total. Again, one thing I encourage you guys to do, and we are going to be changing how we display the numbers, both on our website and on Facebook. That's another area we post data. But we are going to start doing the math for people so that you can see active cases versus just positive confirmed cases. So while there's 161 cases in Wexford County, that doesn't mean that they're all active cases right now. And so if you look at Wexford County and we look at the recovered cases, so Rich, get your calculator out. If you take 161 confirmed cases, and right now there's 107 recovered cases. So that means that the individual is still alive after 30 days from their diagnosis date. So 107 recovered. If you subtract 161 from 107, that would give you an idea of how many cases are currently active.
54.
Meaning, okay, so there's 54 cases right now in Wexford County that we would consider active, meaning they're still within that 30-day period where we would designate them recovered.
I see.
Yeah, so that's where we're at with Wexford County, and with Missaukee County, the recovered number is 45.
I see.
And so if we took to where we're at today with our case numbers, which is for Missaukee County, total we have 74, and then we subtract the recovered number from that, which is 45.
That should leave 29.
29 active cases. Well, that's
29 active cases.
That's more encouraging, isn't it? So it's not as severe as it looks. And I'm not dumbing it down. This is a very serious situation, clearly. But thank you for explaining it to us that way. And I didn't realize the gestation, or if you will, the length was a full 30 days till you would consider someone recovered. Meaning, if they get through 30 days, they're going to live, is what you're telling us.
Well, most likely. Again, there will be people that will say, we're still not out of the woods.
Okay.
There are a lot of people that still that had the virus and are still suffering from consequences of the virus, and may always have health conditions that long after, due to having the virus, it's compromised some other things within their health. And so, but again, for the sake of providing a recovered number, that is the formula that we use to be able to give you a number, understanding that maybe not everybody still feels great, but most people, yes, within that 30-day period from their diagnosis date, they are still alive after 30 days. They're considered recovered.
It's interesting to me, Jeannine, that this is not a one-size-fits-all situation. Everyone reacts differently to this virus, and some people get significantly sicker than others, and some people aren't that ill. So it's just impossible to predict how it's going to affect you, isn't it?
It really is, and I think a lot of people have that argument that yes, the cases are going up. A lot of them are the young demographic that they're not typically as impacted by this virus as the older demographic, or those with health conditions that their body just isn't strong enough to fight the virus off, and it impacts them a little harder than others. But the cases that a lot of the cases that we're seeing are in in young people who tend to are more resilient and tend to bounce back and get healthy a lot sooner than others. So we're not seeing the death rates going up at all, very little. In fact, from August through, so if we look over the summer months and now that cases are going up, we're not seeing the death rates climbing to coincide with the cases climbing. So that's encouraging.
Okay. And you do believe part of that is related to a younger demographic of people getting the virus?
Yeah, I mean, if you look at the data dashboard and you look at the deaths by age within our 10-county jurisdiction, the age range of deaths does fall within that, tends to fall within that 60 to 70 or older age range that we're seeing the deaths occurring primarily. So of the deaths that we've had, 18 fall in that 70-plus category, 9 fall in that 60 to 69, and then it just gets a little younger from there. 3 of them fall within the 50 to 59. We did have a death, one that fell within the 30 to 39 age range, but only one. So you can see primarily it's the older you are, those are the ones that we're seeing that are struggling, and some of them are dying.
And I think also now in October, at the end of October, 7.5 months after this arrived, I would think doctors, hospitals know better how to treat it too.
Right.
Right. I don't know if, so again, there isn't a designated treatment that is available for doctors to prescribe that would remove the virus, if you will, that would cure the virus. I know that treatments I think they're in that FDA approval phase, so that they can be accessible to the general public. But again, treatment is really treating the symptoms, like reducing fever reducer and cough syrup for your cough, but it isn't necessarily treating the virus itself. Mm-hmm. But that is coming. I think science is starting to catch up with it, and they know more about it. And so hopefully soon we will see a treatment that'll be accessible to almost everybody to kind of limit the impact of the virus if you do get it.
Now, when you were referring to treatment, are you talking about a vaccine, or is that separate from a vaccine? You refer to it?
Treatment, I consider treatment separate from a vaccine.
Okay.
So, I think we all are aware that the president was ill with COVID, and he was given a cocktail of treatment that helped his symptoms and helped him improve very quickly. That I would consider treatment. There isn't a vaccine yet, and we know that those are right now in trials as well. So that's why, again, we still are paying so much attention to this, because we don't have a readily available treatment or vaccine for COVID-19 yet, like we do flu.
So, Jeannine, you brought up the flu. I mean, the rest of your work at the health department didn't go away when COVID hit. How are you juggling the other things that you handle in addition to this pandemic?
It's a huge challenge.
Right.
If we could add more, I told somebody yesterday I would like to buy some more time on Amazon if I could, but it just isn't available. So we're just doing the best we can, and we have, because of this increase in cases in such a short period of time, it requires us, again, we try to do our best to notify individuals within a 24-hour period so we can investigate and do contact tracing. But what we're finding is that because of the huge increase in such a short time, our staff is struggling to meet that goal of 24 hours. Even the state level, the state health department, we're utilizing some of their volunteers, and they're struggling too. So we encourage people that if you were contacted by a friend or family member that told you they have a confirmed case of COVID, and you were near that person, you were a close contact to that person, we want you to start your quarantine right away. Don't wait for the health department to call you. Try to start that quarantine right away, and know that we will be calling you as quickly as we possibly can. But the increase in cases has really impacted our capacity to respond as quickly as we were able to in the past, or as quickly as we would like to.
Contact tracing seems to me like a Herculean task.
Right.
Does it not, Katie?
Herding cats.
Who were you with? How close were you? How long was it? What day? Oh my gosh!
Right.
You basically, you're asking people to account for almost every minute of every day and what they did. Wow, that is tough.
Right, and
it is tough.
I think we're also seeing a new respect and appreciation for the health department.
Right. I mean, if you can imagine, especially with young people being the ones, not all, of course, all ages are having cases, but for that young demographic, the school-aged kids and the college kids that are getting COVID, can you imagine them being in a classroom around 30, 35 other kids, And so one kid or one teacher comes down with COVID, and now the contacts that they've been around are in the double digits, like 20, 30, 40 for just one case. And we have to do contact tracing for every individual case. So that's another reason that, again, our capacity to respond has slowed down a little bit, but we're doing the very best we can and trying to do it as quickly as we possibly can.
And what does that conversation look like on the other end? I mean, you're calling someone and you don't have the best news. How does that go?
Obviously it varies, but we are experiencing some pushback from people that just do not want to help and do not want to give their close contact information, and they don't believe that this is really a problem. They don't want to get anybody else in trouble. So we are running into that challenge of people either not taking our calls when we're trying to call to do contact tracing, or just flat out refusing to give us the information we need so that we can notify those that we're in close contact. Not that happens all the time, but we are seeing that.
Wow.
In a lot of instances.
Jeannine, for folks that are in nursing homes and assisted care facilities, are you advising don't go and visit those folks? Is that what you would say?
Well, the state did recently come out with new guidance for nursing homes and assisted living. Residential care facilities is what we call them. And it really is up to the facility to make the determination on visitation. But we do have guidance on our website that talks about residential care facilities. You can find it at dhd10.org/coronavirus. If you scroll kind of to the middle of the page, we have a section called COVID guidance. And in that area, you'll see guidance for residential care facilities. The state issued that within the past couple of days, and we put it on our website.
Okay.
And that's for residential care facility, administrators to help put their plans together on limiting visitation, and for those that have loved ones in residential care facilities on whether they should or shouldn't visit. So there is guidance there, and we just encourage you guys to, if you have loved ones in residential care facilities, take a look. That information is on both our website and on the state website, michigan.gov/coronavirus. You'll find it there too.
Wow. Well, Jeannine, you're doing such important work, and the community thanks you, because the word Herculean is what Rich used. That was the word. And there's so much work to be done, and it is absolutely overwhelming. And your folks are doing a tremendous job keeping us safe.
Well, we appreciate hearing that, and we appreciate you helping us get the word out. We appreciate the public that, is taking this very seriously, and, we just encourage everybody. Again, the mitigation strategies have not changed in prevention and protection from getting or spreading the virus. It is still wearing a mask, social distancing, washing your hands regularly, staying home if you are sick, and avoiding large gatherings, especially with people that are not in your immediate family. I do quickly want to say, I know that there has been some confusion about mask wearing with regard to the governor's executive orders, and the fact that the Supreme Court ruled that the executive orders are unconstitutional. I want to remind everybody that the Supreme Court did not rule that wearing a mask was unconstitutional and that you don't need to wear a mask. That wasn't what they ruled on. What they ruled on was the executive orders themselves, having gone beyond what the legislature had given as a date on when they were supposed to end. So the legislature had a date. I think it was April 30th. I could be wrong, and then the executive orders, continued on past that date. And so it wasn't what was in the orders; it was that the orders still existed beyond the legislature's date. But so masking is still required, and it's still encouraged, and it's the best way to protect you from me and me from you.
Thank you for the clarification.
Rule of thumb is until we have that vaccine out there and widely distributed to everybody, wear it.
Yes.
Plain and simple. Yeah.
Correct.
Jeannine, thank you. I hope that the next time we talk, it will be under gloriously better circumstances.
I know. I was just thinking that. I was thinking in a few months we're going to have her back, and it's going to be rainbows and butterflies. How about that? Because you deserve it, and so do all your people.
Let's just hope on, January 1st, 2021, it'll just magically disappear and we'll all go back to normal.
I like it.
2021 has to be better than 2020,
Has to be.
I think. Yeah.
Has to be.
Oh, I hope so.
Jeannine Taylor, Public Information Officer of District Health Department number 10. We appreciate your time this morning. Thank you much.
Happy Halloween.
Thank you.
Cadillac Unscripted is sponsored by Independent Bank and Remax Central. Marianne Quist will do it again next week, same time, same station, 107.9 CDY.